International Epilepsy Day is an annual event organized to raise awareness on epilepsy and its impact on individuals, families, and communities around the world. The training of trainers being organized by the Foundation for Epilepsy and Stigma Support Gambia, called FESS-Gam, for young nurses is meant to create a better understanding of epilepsy among health service providers and to raise awareness on the conditions in schools. Dr. John Jabang, Vice President of FESS-Gam, and Dr. Buba Manjang, Director of Public Health Services, both discussed the significance of the training.
Today we are expected to train you so that you can be able to be the ambassadors, go to the schools, and create awareness on what epilepsy is. The other objective we will do with this project is to also train the healthcare providers. So that project would come on later.
We want to see epilepsy to be free from being, the patients to be free from being stigmatized, and also attention to be paid to them, and also diagnosis to be given to them, and they are part of the society, so that they can play their meaningful role and responsibilities towards national development.
Epilepsy, according to officials, affects almost every aspect of the life of the person diagnosed with the condition. For many people living with epilepsy, the stigma is more difficult to deal with than the condition itself. This, they added, is as a result of misconceptions and myths surrounding epilepsy. This year's International Epilepsy Day campaign seeks to dispel these myths and misconceptions by sharing facts about epilepsy. Thus, the theme Stamp Out Stigma. According to officials of the foundation, educating students on epilepsy facts will help dispel myths and misconceptions, while subsequently reducing the stigma and discrimination faced by people living with epilepsy.
We were also able to visit 112 schools from Region 1 to 6, and we are able to assess students approximately 853, which is the 358 were girls and 366 were boys. On that note, we do come across high number of epilepsy cases.
Epilepsy is a big challenge for all countries, so we need to support this issue. Sometimes it's difficult to put diagnosis of epilepsy. Even if you do EEG, sometimes it's become normal, so you cannot explain to the family, so this is a big challenge.
Participants, most of whom are nursing students from the Gambia College and the University of the Gambia, are hopeful that the training will improve their understanding on epilepsy, its symptoms, causes, diagnosis, and case management. Janket Ture, GRTS News.